What can new dentists expect? How can they understand the dental market the way it is now and how it's going to continue to change? I mean, we're still in COVID, but let's say in the post-COVID world.
Well, I think there's going to be some more opportunities that there aren't now, because there are principals that realized getting through COVID was exhausting for them, and that maybe their length of tenure, how long they're going to stay, is shortened. Also, they're realizing, I think a lot of people realize balance. And when the people that were out of balance realized when COVID hit, that balance is such a critical part of what will keep us fulfilled and will keep us energized to remain. I think with the new dentists understanding the market, it's not letting the market beat them down. It's learning to accept no. Sometimes it's a skill in itself to learn to be told no when you're first starting out, because no just means next opportunity to me. And the ability to be able to receive no. And confidence doesn't always come from the people that all like us. Confidence comes from learning from the people that didn't choose us.
Right.
And how could we work to change that in the future? I think the associates nowadays must stand apart. Stand apart from their colleagues, because there's so many looking for positions. And by doing that is knowing themselves, having their digital footprint, networking with all of their groups, and organically they will get recommended for positions. The new dentists coming out that stay as a lone ranger by themselves, they're the ones that tend to get negative and down and start to blame outside sources.
Right.
So there are positions. People going to like Indeed or going to a university posting, that's just like 10 or 20% of the positions that are out there. The best fit positions come through networking, because you've taken the time to invest time in people really getting to know you, and if you're interesting and you're memorable, they will then refer you or let you know about opportunities, or you reach out and say, if you hear of anything, please think of me first. So it's a dance. It's quite the dance, but if I could just say one thing, don't do it alone in this market. Don't do it alone.
No, I completely agree with that. And I think, some associates have said to me, or they're working as associates, and I asked them, how did you find your opportunity, and what is your advice? Now, some associates believe take any opportunity that's offered to you. What do you think about that?
Well, I guess you could throw enough stuff against the wall and something's going to stick. But is it going to be? How long is it going to stick? And is it going to be the right thing long term? Principals don't want rotating associates. They really don't.
Right.
They might seem like they do, because they don't do the work and the right fit either.
Right.
I work on this. Remember, it goes two ways, right? There needs to be some preparation. There needs to be some research on the associate's part. There needs to be some key questions. Some associates say, well, I took the position and I have 2 patients a day. I go, well, on the interview, did you ask how many active patients they have? What is the purpose of my position? What patients will I be seeing? How do you want me to bill? What procedures don't you do that you'd like me to learn how to do so you can keep it in-house? Like, there's some basic things that the associate, I often say the associate, really, you need to take the lead in interviewing the owner of the practice. Not in an arrogant way, but you need to take the lead on understanding their business and how they've got to where they've gotten to before you can even know if there's a place for you. As opposed to just take the position, you get 40% net lab, start Monday, and the team goes, oh, we have a new dentist, like, what's your name? It's silly. If you think about it, I'm not mocking it. It's a ridiculous way to start anything, is just to take what's available. I also think working interviews are really important, because a paid working interview, by the way, I'm not about new dentists doing procedures and not being compensated. That's not right. But a paid working interview, so that they can see the flow, the operations. They can have chance to build rapport with the people that work there before they just show up one day and they're told there's a new dentist to fill a schedule for 2 days or 3 days or 4 days. Also spending some time with the owner on their philosophy. Because when a principal feels like a new dentist comes in, I often say to the mature traditionalist dentists, they go, Lisa, like, they don't want to work and they just expect it to be handed it to them. And I said, listen, we've got a generational diversity here that you need to accept. And you spent decades climbing to the top of your mountain. The great news about them is they're going to pay you a lot of money for the top of the mountain. Don't expect them to walk backwards in blizzards barefoot. It's a different generation, right? So I think it's just continual communication, meeting, collaboration, and the more we spend time together getting to know each other, the better the relationship will be, or the more clear that it's not a good fit, and we can professionally go to our different stages of happiness that aren't here. Because I've seen an associate absolutely fail in one place, not because of just them,
right,
and thrive the next place. You know, and it's how do you know in the beginning? I think there's things that a lot can be done to prepare and to choose, as opposed to just taking an ad.
Right. A couple things come to mind. So the first one is this concept of backstage, and then you're sort of performing to some extent in front of the patient. So if you have disagreements about the treatment plan, or you know, for instance, with the principal, you can talk about that. You know,
that's a professional conversation.
Sure.
And with people that sometimes dentistry, they learn to whisper at a steel mill. They don't think anyone can hear them. Dentist practices are quite small.
Sure.
But it's setting up a treatment planning review, or if I have something that I'd like the principal as the new dentist to look at, I don't have to do it on the fly. Like, there's no rush. Right? If I say to the patient, you know what, I really want to take time with Dr. Smith, who's been your dentist for 30 years, and collaborate on this, and invite you to come back next week and for a consultation or teleconsultation, however people do it. There's nothing wrong with that.
Right.
It's a marathon, not a sprint.
So I love the idea of pitching an associateship to somebody who's been thinking about it, right? And showing initiative in addressing those learning needs that you've identified, right? So you know what you're good at. You say, I can do this for you now.
Yes.
I'm interested in learning how to do this so that I can do it for your patients, you know, and so then the principal and their staff understand the case selection is very important for you. As you're learning the new skill, you're not going to maybe tackle the hardest one, but ultimately you'll be doing certain types of procedures, and let's start to those patients that will need those procedures as you're developing skill, you know.
Well, you know, it's something as simple as me asking you, what are the procedures you do not like to do?
Right.
Because I can put them on my learning goals, so together we can. Patients don't want to go to another address if they don't have to. They really don't want to be referred out if they don't have to. They'd love for you to do it in the same place that they're used to coming. But an associate could just say, what procedures is it you don't do that I can add to your practice, and that's how we'll be better together.
Right, and they are, you know, you are honest about the fact that you're committed to gaining expertise.
Yes.
And so you'll be doing some consultation, some case, you know, careful case selection, so that you can gain confidence, maintain the patient's trust, and develop that skill and efficiency with the staff, and so on. Yeah. I think it's also interesting that patients like to come to the office because for them the patient experience isn't just about the interaction with the dentist.
No.
They, you know, they like to chat with some of the staff. They look forward to seeing a particular dental hygienist.
They have relationships with people before the associate, and you need those relationships to be the bridge to trust as fast as possible.
Right.
So what do? Is I would invest in in that team and and the people that are going to make me successful. Right? Oftentimes the team can make the associate successful more than the principal, because the patient comes to the checkout, the principal's scheduled out for a long time, and they can say, they don't say new or baby or junior or young. Oh, I've heard it all.
Yeah.
Is we do have another dentist that works with Dr. Smith that he's personally chosen to provide those procedures, and they do have availability for your schedule. When would you like to come?
Right.
Right? So they can make or break it. Because the patients look them right in the eye and say, would you have dentistry done by that person? And I often tell the team, it's a career-ending move to say no. Meaning, if you wouldn't have the dentistry done in the place that you spend 80% of your waking hours in your job, then there's a disconnect. That's a bigger issue.
Right. So, I mean, a lot of these things, so in terms of, if you have somebody who's new to Canada, and, you know, I mean, isn't maybe an extrovert. I mean,
It's tough.
But they can learn certain phrases, certain ways of talking to the patients that don't make the patient anxious,
Yeah.
that
Some tips,
inspire,
like some tips?
inspire confidence.
Well, I say please, say thank you, hold the door open at all possibilities, escort people personally through different areas of the dental practice, and do not ask them how they are. It's the most overused question of cocktail chatter. It's going to take a while to go deeper. Take time to prepare by reviewing the charts. And by charts, I mean if they're paper or on the computer. Right. Know the person. Get to know the person. What's their preferred name?
Right.
What do they prefer to be called? If it doesn't say, ask them, what would you prefer I call you? And getting their 2-minute story. This is a big thing. Every new dentist needs to have a 2-minute story that they can answer and they've practiced. And as much as it might not sound authentic, practice makes perfect, is to get their 2-minute story of who they are, what they're about, and what they're committed to when it comes to patient care.
Oh, the new dentist.
Yeah, the new dentist, even principal dentists, when they lose their 2-minute story, or they have a new patient. They could have 2,500 patients of record. A new patient comes in and says, "So, why you?"
Right.
Well, because I'm a good dentist. That's not the answer.
Okay, so what about putting that down in words, like on the website? Because every practice now has their own practice website.
Absolutely. First of all, the associates, I'm blown away at how many principals are not putting their associates on their website because they're afraid they won't last. I go, that's working out of scarcity and fear.
Right.
If you've got the right selection, you need to be comfortable in your choice, and we're going to build them, because patients, when they hear the new associate's name, have to find them somewhere.
Right.
So getting associate saying, so I've got my photo and bio, who is your marketing person that can get me on your website? Sometimes the principal doesn't. I mean, it took me years to get dentists to have a website, right? So sometimes they don't think of things like that. It's not like it's aggressive. It's just, this is the passive. This is one of the things that will help it work. I've got to be known, and if you want me to be known under this roof, I need you to include me.
Right.
And I'm amazed at how many. I go, why aren't you on the website of that practice? They go, they wouldn't put me on. I go, what a shame. I go, there's no way you could build as good as you could be if you're not shown as a present dentist in that location.
Right. So the 2-minute story can be the basis for the bio.
Who I am, how I got here, and what I'm committed to.
Right.
Right? So if I said to you, my name is Lisa Philp, I'm a registered dental hygienist that is committed and passionate about growing dental practices and the health of the team, the business, and the patient, so that dentistry can thrive and be a major part of healthcare, because the oral health is the gateway to overall body wellness. It's not that something people can't argue with, it's my story. You can look at it and go, wow, it's a lot of words. Well, that's my story, right? And that didn't take any more than really 30 seconds. So they do need to practice that, who they are, how they got here, what's important to them, and then connect it and bridge it to them, to the person they're talking to. We've got to be memorable in that first 2 minutes to be chosen.
Right.
Right? And also for someone to assess, is this worth going down this road for us to learn, get to know each other better? And they need to be memorable.
Right. So can I take a different angle on the competition?
Yeah.
I think there's a competition for posted positions. I think that there are so many possibilities for new opportunities.
You mean at workplaces for dentists?
No, like there's so many oral health care needs that are not being met, right? There's treatment that hasn't
35% of Canadians don't go to the dentist.
Right. I think that, what you want is to find a place where you can grow and you can stay, ultimately, right? And attract new patients to the practice. I don't mean the people who are jumping from practice to practice, but people who maybe haven't gone to a dentist very often or very regularly, who don't have that trust in, the profession, or who don't maybe value their oral health care needs. And I think that becoming, I just think there's possibilities. And there's also
so many.
And sometimes it is a matter of convenience, and this is why we've seen the evenings becoming a regular thing. Now some dentists even work on Sundays. It doesn't work for everybody. It works for some people, because there are patients who need it to work, so that they can get their dentistry done. So I think that the entrepreneurial mindset of the associates, or of the new dentist on the market, how do you create new opportunities for themselves, for the practice,
Well, I think, probably the first part is getting the confidence and the comfort in when there's a positive experience, recognizing it, and just asking the patient, if you have anyone else in your friends or family that would like to see me, I'm building, and I would welcome them and treat them the same way that I've treated you. Also, it's getting the courage to, providing you've had a great experience today. Sometimes they say on a scale of 1 to 10, and sometimes the auxiliary can help out with asking the team member, on a scale of 1 to 10, what would you rate your dental experience with Dr. Smith, with the new doctor today? And they say it was an 8. And then being able to say, we'd love for you to be able to write a review on that, because we're working really hard, because patients are rating this doctor very, very high in their satisfaction and in their connection. Or it could be something as simple as, if I could have done anything different today. Sometimes when I'm sensing someone's not quite comfortable, or because Canadians don't always say what's wrong,
right,
to the source,
right?
They want to be nice. So sometimes if you're sensing someone's uncomfortable, or you're sensing something's not really connecting, is saying, if there was anything I could have done different today, what would that have been for you? And it gives them the safety to be able to take the feedback. We need to receive the feedback without defense,
right?
Because we asked for it. Thank them for it, and learn from it.
Right, and absolutely, it is a gift. If they will trust you enough to tell you about their concerns,
or what they would like different, in their expectations.
Instead of posting it on on a review site or leaving the practice. I mean, really, it's an opportunity to do better and to turn that relationship around.
68% of Canadians change dental practices because of indifference.
Wow.
That's our disease, not perio, not missing teeth. It's indifference. And think of what is indifference. Indifference is they don't feel like we care about them. I call indifference close to apathy.
Right.
Lowest human emotion, pretty well before dead, because I don't care, and I don't care that I don't care. But when a patient feels indifferent, like you're indifferent to them, they will move easily. And they say that came out in the study with the Canadian Dental Association. If you don't take time to get to know me, and I don't feel like you understand me, and you've communicated with me, and what you told me I need, a big thing that comes up in this is, a lot of people say Canadians only want what insurance covers. No, they don't. They want to be known what is a fair fee, been shown why it's a fair fee, and for it not to change.
Right.
Drives them absolutely crazy. That's where a lot of the bad reviews are, is I was told it was this much. When I got in there, it changed.
Right.
They don't like that at all. But that comes also from indifference, lack of connection. Lack of connection in my approach, how I interview you, with not close-ended questions. Like, we'll teach this in the course, right? You don't say, how are you? He'll go, fine.
Yeah.
Some people tell you, and you lost them. They know you don't care, or you're not paying attention. But tell me about your dental experiences so far. Tell me about what's changed in your life. Right? I tend not to encourage. I don't think I'm going to encourage dentistry to ask about COVID, because people are going to be so tired of talking about it. But it's real. It happened. Your greatest learning that you learned when you're in lockdown. Getting to know them as a human, knowing what their name is, and using the people that know them for some information so that I can walk in. I did hear today in our morning preparation meeting to prepare for your visit today that you love to have your teeth whitened, and you've had it done 4 times. How's that going? And they would never be able to say they didn't know who I was. They didn't prepare, and they treated me like a number.
No, patients don't like that.
I think in healthcare in this country, the other part of healthcare, I don't know. I've never been to an after-hours clinic except when COVID happened, and I went, wow. Hi, sit, health card, wait. And I looked at her, I said, it must be hard for you to work in this difficult time, but it'd be great if you just used a few sentences. I don't know what you mean. I've never been in an after-hours clinic before. She said, have a seat, we'll get to you when we can. And I just smiled, and I said, thank you. And she was so trying not to smile back. But you know what? People want a positive environment. I mean, it's not like, it doesn't mean they have to be the Ritz-Carlton with massages in the reception room. I just mean they want to know that someone's taking the time to look them in the eyes, eye to eye. 10% of our relationship skills are words. 30% is tone of voice, not what you say, it's how you say it. And 60% is our body language. our facial expressions, our eye contact, our posture, our position. So when I encourage new dentists, I say you walk in there with the 60%, hold your shoulders back high with a smile on your face showing that you're open. That's all I mean. That's not fake. That's just using your gifts.
Right.
So that you can have some people attracted to you. Humans are attracted to positive people, even the miserable ones.
Even the miserable people are attracted to positive people. Yeah, I mean, I think that, you know, I was just observing actually your body language as we were speaking, and you bring this energy, and you know, I love
passion.
Yeah, I love to go to dentists who love dentistry.
Yes,
is one thing. You know, dentists who are excited about the new thing that they learned at the last course.
Yes.
You know, so they talk to me about it because I'm a dentist, maybe, but I don't think that they just talk that way to me. I think that their enthusiasm shows. Yeah.
They gotta live it, right? If we're living our passion. Now, there are some dentists that would tell you they don't like dentistry, and I said, so what are you gonna do about it?
Yeah.
Like this, you're bent over 32 hours a week. I don't know. You don't like it. Maybe look at changing your mindsets of how you see it. Right? Because sometimes they don't like it because they have turnover, or they don't like it because the lab messes up their models, or they don't like it. I said, well, so tell me what you don't like about it. It's actually very rare. They don't actually like the procedures. It's the stuff around it.
Right.
Oh, I don't like leading these women, or I don't like when they cry, or I don't like when a patient doesn't pay, or I don't, you know, it's not the technical procedures, because they go through a lot in 4 years with their procedures and their technical training to figure out before they graduate if they're going to ever be able to like it.
Right.
That part of it. It's all the other stuff.
And I think, you know, you've talked about this before, is they may not like all the procedures, but we actually have so many options of how to organize our practice life.
Well, a general dentist means you're a generalist, but a generalist, you have all the choice in the world to choose what you want to do and what you don't want to do. And I think today, not always the case, today there is a solution for every problem or procedure that you choose not to put in your repertoire.
Right. Not only that, with this explosion of new technologies and tools and I'm going to say instruments and all that, you know, which I learned about because I did some hands-on training here at Prep Doctors myself. Oh my gosh. You know, what we have available now compared to when I was in practice to make restorative dentistry so much easier. It's so interesting to me.
You know, something as simple. I remember the days when going from the high-speed handpiece to the electric handpiece. And I'm like, what's going on with the numbers in these dental practices? Because it's more efficient, it's faster. It wasn't a gimmick.
Right.
But it's like a new dentist comes out and says, can you order me 3 electric handpieces? You might want to put that in your learning goals.
Right.
Right? Like coming in and saying, I need all this equipment.
No.
For a principal, you don't do that in the beginning. You know, I need a special rotary endo thing at $6,000. I go, well, you're a contractor, so if you need to bring your tools to work to be successful, that might be something you want to invest in. But coming in and doing a demand, that's a big issue. Coming in, I want this, I want this, I want this, I want this, that the principal doesn't have.
Right.
You work it over time. But, you know, there's the technology, the digital impression. I'm so excited because a dentist has a lot to make them so much more successful. That's not just about how they fulcrum.
Sure. So there's technique. No, but I guess what I'm saying is there are solutions to the problems. Like some of the things you don't like, you can learn to do better. Certainly, if the principal's been successful doing those techniques with their stuff, they can give you they can give you tips.
Yeah.
Right. The other thing too. This is a communication tip that I came up with when I worked in practice advisory. Right. So I'd say, you should talk about the common benefit or the common risk. So let's not talk about risk so much here, because there people were calling me at the regulatory body and saying, you know, there's a patient complaint, et cetera, whatever.
Right.
But
common benefit to the patient?
No, to the dentist, the associate, and the principal, for instance, right? So, I mean, someday, I think that if the principal knows the associate wants the practice to grow, they're both going to benefit from that growth. Now, there could be some new technique that, you know, maybe the principal would be interested in, you know, hearing about that you've gone about the course. Or, you know, why should the principal buy this new equipment? Well, I mean, don't make promises you can't keep, but at the same time, it's going to also help the principal. You know, it's sort of a bit of sales and persuasion.
I know some of our principals that I went to a course with the associate, did you know there's this?
Yeah.
I go, isn't that awesome? I go, you've come together with your wisdom.
Yeah.
Because you were busy doing what you were doing, and now someone's brought you a new rejuvenated thing to be able to do. Now you can work on them together.
Yeah. But I think it's the common mindset, thinking like an entrepreneur.
Yes, from day one. Can I share?
Yes.
An associate would come in and say, I am an owner of my destiny right now.
Oh, I love that phrase.
I'm an owner of my destiny.
Uh-huh.
And there's myself I've got to learn and be and grow. There's other people I've got to learn how to be compatible, not like everyone.
Right.
You know, dentistry often hires in their own image, and then we've got this big group of clones.
Right.
Right. The differences are what make us beautiful together.
Right. And I think, you know, the associate can complement the principal.
Absolutely.
You know, they're...
If they own their destiny, they don't look they're not entitled.
Right.
Right? And, you know, don't come in and offer an owner. You're going to bring them 900 patients in the next new year if you just move to the country and you don't know anyone.
Right, sure.
That's over-promising, right? But if they own their destiny in their procedures, they own their destiny in how they work with people, the team and the patient, and they own their destiny in what their future plans are to building and growing the practices, the principal's business, with the potential one day to maybe be the owner.
And I think that we can ask feedback, not just about our technical skills, not just about our chairside efficiency. Also, those moments that don't go that well. I mean, so I like your positive mindset of what could I have done better directly to the patient, but also...
Or what could I have done different?
What could I have done different?
Yeah.
But actually speaking with the other people who were there, okay, so you noticed, you know, the patient seemed a little bit upset, right? How can we address that together? How can we... problem solving also where there's been difficulty communication-wise is what I'm getting at.
I mean, problem solving's another one of my passion. I would solve problems for sport, but not create them, solve them. A lot of times I find people don't know how to define what the problem is. So the first step is let's sit down and define what went wrong. What was the problem there? Not who.
Right.
What was the problem? It could be, you know what, a patient had a bad day, was told something in the business office, and it changed in the clinic and no one knew.
Right.
You know, sometimes little things create big problems, but defining what is the true problem, what caused the breakdown, did we address it or did we ignore it? Because a problem ignored is like sweeping and it's going to explode eventually.
Right.
And talking about it, right? Like associates, go to team meetings. Show up to the team meeting of where you work, ask them, how am I doing? What can I do better? And be truly ready to receive is not a weakness. It's a strength.
I think that there are also so many moments of interaction in between patients and so on, right? You know, yes.
You can debrief.
And the rapport building with your team member.
Yeah.
Right? So there's the actual, you know, before the day starts, you're planning for the day, but you're also kind of checking in throughout the day, right?
Yeah. You know, something as simple as, can I help you sterilize these instruments and flow them through? What did you see? Because see, the other person that's there has a different window to the experience, right? Just ask them, so what happened there? Sometimes I just go, what happened there? Someone comes back and says, Lisa, you didn't connect with them and they want nothing to do with you. I go, oh, okay. I'll bounce back from that. What was up? What do you think I did? Or what happened? And when you show that humility, and people will tell you the truth, they might say, well, you know what, she was talking and you interrupted her 3 times or something, right?
Right.
But showing we're all in this together, how do we make it, you know what it is? It's going from an appointment to an experience. Appointment is set a disconnected task. Hi, have a seat. How are you? Have you changed your health history? Great, let's get going.
Right.
Open your mouth. Let's put a rubber down so you can't talk back. Boom, I'm being silly to make a point. To an experience. Thank you so much for choosing us. We're so glad you're here in these challenging times. I want you to know that you're completely safe. Our patient priority is number 1. Come with me to your treatment room. Tell me what's changed in your life since the last time I've seen you. And then it's to me it's simple, but it's not easy for a lot of people.
But it gets easier with practice.
Well, it's like anything. If you don't practice, don't expect to be a master, right?
I think there's room for all of us.
Absolutely, there's enough for all of us.
And I think that you know, because we understand how important oral health is to systemic health, to patients' wellness, overall wellness, and how important those human connections are. You know, those experiences that make patients feel valued. Honestly, I think dentistry can just continue to grow. I'm so optimistic about it.
And you know, the greatest thing about COVID isn't about the lost revenue.
Sure.
Okay, that's all come back. Right? It's our dentistry has moved to a level of healthcare I've never seen before. Of not being available. I think I'm not a dentist, and I got 55 calls a week with people I just knew I was in dentistry with toothaches. With when are they coming back? Like, this is crazy. Like, I can't get in touch with them. Where are they? Right? And I was like, wow, we were missed. This is the greatest reset ever. Let's take our reset. We were missed. Patients now are back. I mean, our clients are a bit unique because they invest in themselves, so we're very proactive, right? But as a profession, patients are coming back. There's always going to be the few that are going to be fearful or use COVID, DTC, I call it. Due to COVID is going to be a reason why I'm still a C patient. And no show, right? But I think we are a respected member of healthcare, and we can pull dentistry out of the emergency rooms, what we learned in COVID. Emergency rooms do not want bad teeth. They don't want oral health issues. Pull it out of emergency rooms for our healthcare system to thrive.
Right.
And dentists are needed. My mission is they never get shut down again. I don't have all the control. I have the voice.
Right.
And I could be with Lisa Philp on the national news and say dentistry can't be shut down again. And I was one time saying it can't be shut down ever again. We have risen to a level of essential service that we have never been seen by before from the consumers.
Right.
We all know we are. But you know, what do I say? Reputation isn't what you say about yourself. Reputation and credibility is what other people say and feel about you. I'm excited.
Yeah.
Next 10 years is going to be big growth.
Yeah, I really believe that. So I'd like to thank you very much for speaking with us today. I can't wait. I can't wait for the DPE course, and I look forward to talking with you next time.